Your vet just prescribed medication for your pet, but the label looks like it's written in another language. In the next 6 minutes, I'll decode every part of that label so you know exactly what you're giving, when to give it, and what to watch for. All information is sourced from VCA Animal Hospitals, the FDA, and PetMD. Let's break it down. Medication confusion is one of the most common reasons pet owners call their vet after a visit. Sometimes it's confusing dosing schedules, sometimes it's storage requirements, and sometimes the label just has too much information. Here's what we'll cover: how to read dosage instructions correctly, what those label components mean, why storage and expiration dates matter, warning labels explained, and when to call your vet. Before we start, this is educational content to help you understand your vet's advice. It's not a substitute for veterinary care. Always follow your vet's specific instructions for your pet. So, let's start with the most critical part: dosage instructions. You'll typically see something like give 1 tablet by mouth every 12 hours. This seems straightforward, but there's more to it. Here's what this means: 1 tablet, not crushed or split unless your vet says so. By mouth means directly in your pet's mouth, not necessarily in food. And every 12 hours means exactly that, not just twice a day whenever it's convenient. Here's the most common mistake. Pet owners think morning and night means every 12 hours. But if morning is 7 a.m. and night is 11 p.m., that's 16 hours apart, not 12. Consistent timing keeps medication at therapeutic levels. Use a phone alarm. If you give the first dose at 8 a.m., set your alarm for 8 p.m. for the next dose. If you miss a dose, skip it. Never double up. Resume your regular schedule. Giving 2 doses too close together can be dangerous. Now, let's talk about what's required on that prescription label. Every veterinary prescription must include your vet's contact information, your pet's name, the drug name, including both active ingredient and brand name, dosage amount and frequency, expiration date, storage requirements, and this warning. Caution: federal law restricts this drug to use by or on the order of a licensed veterinarian. Cow. Why show both brand name and active ingredient? The brand is who makes it, like Tylenol. The active ingredient is what treats your pet, like acetaminophen. Knowing the active ingredient helps your vet find alternatives if needed. Practical tip: if you have multiple pets, highlight your pet's name on each bottle. A medication safe for your dog might be toxic to your cat. Storage requirements can make the difference between medication that works and medication that doesn't. Refrigerated medications need 36 to 46 degrees, never frozen unless specified. Room temperature medications go in cool, dry places. Eggkais. Here's what most people get wrong. They store medications in the bathroom. Don't do this. Humidity from showers degrades medications. Use your pantry instead. Never leave medications in hot cars or direct sunlight. Eye drops expire 28 days after opening, even if the bottle says months away. Mark the date you opened them and throw them out after 4 weeks. They can become contaminated. About expiration dates. The FDA defines expiration as when 10% of the active ingredient has decomposed. After this, medication may not be safe or effective. Practical system: check expiration dates twice yearly when clocks change. Use that reminder to discard expired medications and request refills. Expired medications become less effective. Injectable medications can harbor bacteria after expiration. For compounded medications, those mixed specifically for your pet, expiration dates are often just 1 month. Pay extra attention. Warning labels explained. Warning labels: for animal use only means do not take your pet's medication yourself. Keep out of reach of children is critical. 60,000 children visit emergency rooms yearly from accessing medications. Pet medications often smell like candy or chocolate. Shake well means ingredients settled. You need to mix for proper dosing. Do not use if pregnant is for handlers. Some medications absorb through skin. Call your vet if you miss multiple doses and don't know how to resume. Your pet has side effects like vomiting, diarrhea, or lethargy. The label becomes illegible. Your pet refuses medication, or you're thinking about reusing leftover medication. Never reuse medication without vet approval. Even if symptoms seem the same, it could be different, and wrong medication delays proper diagnosis. Common mistakes. Mistake 1. I can stop when my pet feels better. Not true. Complete the full course, especially antibiotics. Stopping early causes relapse or resistance. Mistake 2. I can split tablets to save money. Only if your vet approves and the tablet is scored. Some coatings break down in specific digestive areas. Crushing makes them ineffective. Mistake 3. Bathroom cabinet is fine. No. Humidity degrades medications. Use your pantry. Recap. Use phone alarms for exact timing. Highlight pet names on bottles. Store in cool, dry places. Pantry beats bathroom. Check expiration dates twice yearly. Never hesitate to call your vet. You now know how to read that prescription label and what questions to ask if anything is unclear. If this helped, give it a thumbs up so other pet owners can find it. Drop a comment with your biggest medication question. I read every one. Thanks for watching. And remember, when in doubt, call your vet.